We want to start the bulletin with some hope of arrival of additional doses of vaccines into the country. Kenya is set to receive an additional 130,000 doses of COVID-19 vaccines from the D.R.C. tomorrow. But even as the country sources for more, Health Cabinet Secretary Mutahi Kagwe is now appealing for calm from those who received their first dose of AstraZeneca vaccine, with an assurance that they will still get their second dose. And as Dorcas Wangira reports, the W.H.O now says that there is enough evidence from India's Serum Institute to show that the second dose of the AstraZeneca vaccine can be administered even after 16 weeks and still be effective.
Kenya may still be vaccinating, with 948,980 people so far having already received their first dose. But according to Health Cabinet Secretary Mutahi Kagwe, the country is at the tip and urgently needs more vaccines. Currently, there are about 100,000 doses left from the 1.12 million doses acquired earlier this year, with the United States of America willing to donate up to 80 million doses of vaccines to other countries. Kenya hopes to secure 1 million doses to vaccinate those who had already received their first dose.
As a continent, we must stop believing that there is anybody out there who is a good Samaritan, a biblical Samaritan, who is just about to come and help us. There's nothing like that.
With the situation in India, the government is also holding discussions with other manufacturers of vaccines like Johnson & Johnson, among others approved by the WHO for emergency use authorization. The AstraZeneca vaccine is unlikely to remain the vaccine of choice in Africa because of the delays in shipments currently being experienced from India.
It's everyone for himself or for herself and God for us all, clearly. And therefore, going into the future, the local production, local manufacturing of pharmaceutical commodities and products is an absolute must.
The government, Kagwe further says, is expecting an additional 150,000 doses from neighboring countries like the Democratic Republic of Congo, D.R.C, where there is no capacity to administer vaccine doses before they expire in June this year. The 130,000 doses expected to arrive in the country Friday are part of those returned by D.R.C to the COVAX facility for redistribution. Malawi, Wednesday, May 19th, destroyed 19,610 doses of the AstraZeneca COVID-19 vaccines that expired 80 days after arriving, despite assurances from the African Union and the World Health Organization that the vaccines were safe until mid-July. A batch of 102,000 vaccines arrived on March 26th under an initiative by the AU and WHO, and they expired on April 13th, leaving less than 3 weeks for them to be used. Malawi managed to deploy about 80% of them by that time.
Statement came from WHO which said, no, even if it was expired, we still could use it. But as a country, we had already made a decision that we're not going to use any expired vaccine, because literally it is against the policy, our government policy, in terms of issues of expired drugs. So it is not just about the AstraZeneca vaccine.
But Kenya isn't the only African country set back by India's predicament and the delayed delivery from COVAX. According to Dr. Matshidiso Moeti, the World Health Organization WHO Regional Director for Africa, between February and May, the continent received just about a quarter of the 66 million expected doses through COVAX. There are 4 countries in the continent which have not administered even a single dose of any vaccine.
COVID-19 vaccine shipments to African countries have slowed down to a trickle this month, because of the reliance on India as one of the key manufacturers globally and the devastating surge of cases that that country is dealing with.
In a circular signed by Acting Director General in the Ministry of Health, Dr. Patrick Amoth, the ministry had revised the interval period to 12 weeks.
With data that has been acquired recently from the UK, the Serum Institute of India is estimating now that the ideal time to have used the AstraZeneca vaccine is extended from about 12 weeks to 16 weeks. So I think what we can say is that this is something that is being consistently studied and looked at. And it is very encouraging, especially given the current situation with countries having given a first dose, that there's a possibility then of having an extended interval between the first and second doses when the vaccine's efficacy will not have been affected.
Kenya is scheduled to begin administering the second dose of the vaccine from the first week of June 2021. Dorcas Wangira, Citizen TV, Nairobi.